Hi, I'm Dr. Krishna Chowdary. I'm working as a consultant laparoscopic and GI surgeon at Kamineni Hospitals, LB Nagar. So today we are going to talk about a common condition that is occurring in routine population nowadays, which is gallstone disease. So gallstone disease is nothing but formation of stones in the gallbladder. So what is gallbladder? Gallbladder is a digestive organ where the bile juice that is secreted from liver is temporarily stored for a little while. When we eat fatty food or oily food, this gallbladder shrinks and produces that bile into the digestive system, which when not working properly leads to formation of gallstones. So when these stones are formed, it is not possible or not visible outside. So in a routine health checkup or something, when we do a checkup, we will be able to identify gallstones on an ultrasound scan, which is the most sensitive scan. So we can also find these gallstones in CT and MRI scan, but they are not generally required on a common basis. So what happens when these gallstones are formed and what needs to be done? So when the gallstones are there in any patient, generally in a common population, the prevalence is about 1 in 8 or 1 in 9 cases. So where when this routine population, you go and scan 9 people, one of them will have these gallstones. As long as the gallstones are there in the gallbladder, they will not cause any problem. But when these gallstones slip into the common bile duct, they can cause grave complications like jaundice and pancreatitis. And when these complications come, it is very difficult to treat them. As a common simple problem of gallstones, generally when we operate those gallstones without any complication, what we will be able to do is we will admit the patient on the morning of the surgery, do the surgery, and we can discharge him on the same day, and the operation goes through laparoscopic route. That is only 3 or 4 small holes on your tummy and no scars are visible. So from these things, if any complication happens, then patient might have to stay in ICU, may need a major operation in the form of big cut and also pancreatitis. He might need an ERCP to take the stone out, and sometimes we might not be able to complete the surgery and we might have to remove a part of the gallbladder and leave a part of gallbladder inside. So when gallstones are formed, there are so many questions even among educated physicians and doctors that there is nothing that is going to happen through gallstones. You can just wait it out. There are medications to resolve the gallstones. But sadly that is not true, and there are no medications that will solve the problem of gallstones. Unless you have another problem or a severe heart problem or any severe comorbidity that is going to affect your surgery, the only way to treat gallstones is through surgery, and that too laparoscopy is gold standard, and when done in good hands, a daycare surgery, and you can just live lifelong without any complications related to gallstone disease. So don't neglect gallstones. Whenever you find them on a routine health checkup, go to your preferred surgeon and then talk about the gallbladder surgery, and whenever possible you can take that out and live a healthy and happy life. Thank you.